wonderful members. I'm here today with some of our talented massage therapists that work with us at the Vineyards Wellness Center and Spa. So I'm going to take it around to introduce you to everybody in case you don't know them. And I'm just going to go in the order everybody is on my computer. So Sally is the first one up. Sally's been with us for a really long time. And she's a staple at the Vineyards. You've probably seen her before. We have Sally here with us today. I also have Jing, who's been with us for a very long time as well. You might have been working with her. We have Tina, who's here, and then we have Shanti, who's here as well. Shanti and Tina are some of our newer massage therapists. Shanti, you've been with us for about I'd say about 6 or 7. Has it been a year already?
Yeah.
Oh my gosh, how is time going so quickly? It's just incredible. And Sally and Jing,
now it's not.
I know. Now it's taking a little longer. And Sally and Jing, how long have you guys been with the Vineyards?
I started January of 2011.
Wow.
I know.
Wow.
I know. I don't know what happened. I don't know where the time has gone.
Time flies.
It's retirement time.
Oh my gosh. And then how about you, Jing?
I started Vineyard from 2014 April.
Wow. All right. Well, and you guys were in the old building. You saw a lot of changes. And I still remember our first meeting where we all sat down in the conference room and I introduced myself and I'm like, so we're building a wellness center. And it's been great since then. You guys have been a really great help and we really appreciate all of you. Tina is our newest massage therapist. Tina, how long have you been with us at the Vineyards now?
6 months now.
Has it?
Wow.
Stop it! It has not. 6 months.
It goes by quick.
It does. It does. And in 6 months, you've been able to build a really nice following. And Shanti, you too. You guys have really built up a great following in the 6 months to a year that you guys have been here. So congratulations. And it's always nice to have such talented people to work with. But that aside, just to our members, if you don't know any of these ladies, they're all such fabulous people. So we're really lucky to have all you guys. And I thank you for joining me on the show today. So for our members out there, we are doing a Wake Up with Wellness once a week where we kind of start talking to the managers and to some guest speakers and have people come in just to give you a little content and some information to look forward to and to learn from. So today, I wanted to take a few minutes and talk to some of our talented massage therapists and talk a little bit about massage. Some people go in for relaxation. Some people go in because they have some chronic pain and some chronic issues. So I just wanted to bring the experts in to talk to you a little bit about all of that. So ladies, if you want to chime in, can you tell the members a little bit about some of the benefits of massage, maybe for someone who doesn't get massages often or has never had a massage? What are some of the reasons or some of the benefits that massage has?
There are so many, actually. I can cover a couple.
Yeah.
Pain is one. Everybody knows that they come in for pain. It's beyond pain. It could be for anxiety and depression. And I notice my biggest thing is for the lymphatic system. As we know, the lymphatic system, or you may not know, doesn't have that pump like the circulatory has. So there are two things that are big for that lymphatic system, and that would be massage that pushes the toxins out and the white blood cells and your immune fighting cells throughout your body.
Right.
And another form would be exercise, that jumping up and down, that pumping of lymphatic system.
Okay.
So
and I think that's all really great. One of the things that I've encountered a lot, being in the spa industry, is a lot of people don't realize just how massage is actually not good if you have an active infection or cold or flu. A lot of people say, oh, I don't feel good, I want to go get a massage. They don't realize that they're actually making themselves sicker because of that lymphatic drainage that happens, right?
Exactly. Correct.
Yeah, and then for pain management, I mean, when is it good to get a massage and when is it not good to get a massage? Because I feel like, you know, sometimes a little damage could be done, maybe, but I don't really know.
Well, definitely, if you've just done a strain and you have inflammation, you have to wait for the inflammation to go down. You should not be massaging with that. But as you know, a day or two after, like let's say you've been at the gym and you've really strained a muscle and pulled a muscle. So afterwards, as the muscle's healing, to bring fresh blood flow into the area. But that's why they say with any kind of strain or injury, ice first, so that we can stop that blood from rushing to the area. That's what gives the more inflammation. So you definitely don't want that. So I do get some people that come and they've said, oh, I've hurt my back, and you can just feel it warm. So that, you know, that means it's infected, the inflammation. So it's always best to let the inflammation down, then massage, so that we can get, so that's one thing. And so that's something that we have to look out for too with people. But you know, when your muscles are sore, it's great to get a massage, but then it's to let the therapist know what's going on with you.
Right.
Why your muscles are sore. Then we can tell whether relaxation massage or more of a deeper massage. So feedback and information from our clients are so important.
Yeah, I agree with that too. Being an esthetician, a lot of times I would talk to my clients and I would, you know, try to cross promote a little bit. Oh my gosh, you know, I'm massaging the shoulders a little bit. I noticed they're really tense. You know, you should get a massage. And I've heard a lot of people say, oh, no, I'll never get a massage again. And when I ask why, that's why, where they'll say, oh, it hurts, or I was cold the whole time, or they were really rough, or I was sore for a couple days after. And my next question is always, did you talk to the massage therapist? Did you tell them that you were cold? Did you tell them you were hot? Did you tell them that hurt? And a lot of the times people don't know that they can talk to you. But communication is key, and especially with injuries. A lot of our members are very, very athletic, and you know, they're out playing golf, they're out playing tennis, and so, you know, and they work out. So if they strain themselves, it's not always the best idea to get a massage right away. Maybe come in and consult with someone first, because that could be a contraindication to getting a massage.
A really good rule of thumb with that is inflammation tends to rise for 72 hours. So it's about 3 days from the, you know, the point of the injury. Might be best to stay away from massage. Typically after that point, it would be on the downside, and then it might be okay.
Yeah. Okay. That's great information, you guys, because I don't think a lot of people know that. The other thing I notice a lot of people don't typically know is when it comes to pregnancy that they should not get a massage in the first trimester. They should wait. Why is that?
What?
That's so hard on Zoom. You're like,
Tough question.
I think there's so many answers to these questions, but you know, if somebody is going to have an at-risk pregnancy, or if it's their first pregnancy, or if the body's going to reject it, it's going to do so within the first 12 weeks. So as a therapist, we don't want to be the cause or thought of as the cause, or you know, really, we just want the body to do what it's designed to do without introducing anything new. You know, after that point, massage is fabulous.
Yes. Well, our spa supervisor, if our members at home haven't met her already, Jane is our spa supervisor, and she's officially on maternity leave, which, you know, is just crazy to think she's gone through her whole pregnancy already. But she did say, because she's had a couple massages, and she's like, when she gets out of the massages, and I think she's had a massage with almost all of you, she's like, I can't even tell you how wonderful I feel. So in the second and third trimester, it's actually encouraged to get massage. We have a prenatal massage. Most massage therapists already do their own, but at the wellness center we have a prenatal massage, so that's always a really nice thing to treat. You know, if you are going through that personally, or you have someone that can come in as a guest and have a prenatal massage, it's really beneficial. So the other thing too, and we're kind of on the topic of contraindications, is and I go through it as an esthetician, is people who are going through cancer treatments or have been recovered. Now for facial, I've always been taught, and I've always followed, that if they're in active chemotherapy, radiation, or any treatment for cancer, we have to wait a year after treatment ends for that, because of the lymphatic, you know, circulation and the idea of potentially spreading something or creating, you know, an environment where that cancer can get worse. Is it the same with massage?
Yes.
It seems to me that it can be, except the information that comes out tends to change.
Yeah.
It
And
has
so
changed.
I
That is
always
true.
recommend that they ask their doctor.
Yes.
Go off their doctor's recommendation. And it's always a comfort level thing for the client. If they're comfortable with it and they ask their doctor and their doctor says, absolutely, go for it, that might assist in the healing process.
Right.
Exactly. It's beneficial. It becomes beneficial.
I
Yeah.
have a customer.
But I always ask for the doctor's note.
Yeah. That's a good idea. What were you saying, Jing?
I have a customer, she has leukemia, but after she asked her doctor said she can get a massage.
Oh, good, good. Yeah, I mean, especially going through something that traumatic, having a massage seems like it can really benefit that anxiety and the mood, and even just the overall feel of what you're going through. So I can see that being a really nice addition, so long as your doctor approves. How about,
I think, just to add to that, Laura, that I think in the very beginning, when they started the cancer treatments, and it seems like 10, 20 years ago, it was absolutely no vitamins, don't eat healthy food,
Right.
no massage, just lay there, do nothing. And now they're changing, and you can see, I mean, I myself am a cancer survivor for 4 years, and
wow.
everything's changing with now, especially I find here, you know, that's eat healthy. Yes, eat healthy, take your vitamins, do everything you can to make yourself feel better and rebuild yourself. So it's changing, and definitely I'm finding that a lot of people that are in chemo or radiation are still doing basic massage, like very gentle massage. But
Yeah,
it's
that's
changed.
good. That is good. And it's nice to see and hear that the industry is changing and growing. And with massage therapy, you guys have to do continuing education all the time, because it's a very important thing that you guys know exactly what you're doing with the body and what the latest and greatest trends and things are going on. So I think that's something very unique to massage, where that continuing education is something you have to do. Whereas, you know, with skincare and hair, you do a little continued education, but if you want to stay on the latest and greatest, there's like an angry bird outside. If you want to stay on the up and up, you really have to just do that on your own. So I do like that about the Department of Health and massage therapy too. Since we're, you know, still talking about the contraindications, I've heard both sides of people with advanced diabetes too. And like when they start getting that bad circulation in their legs and their ankles swell and they're retaining water. And what are your thoughts on that?
I think, again, for me, it would be go with your doctor's recommendation and your comfort level.
Yeah. Yeah.
Right.
I've seen some pretty good things come out of massage when it comes to that water retention. And those, you know, really, yeah. So excellent. Well, thank you, ladies. How about, I have some questions here. I'm just revisiting. How about, okay, say a member doesn't come to the wellness center for whatever reason. I don't know why you wouldn't, because it's amazing. But say you're on a trip, or you're on a cruise, or you're in Alaska, I don't know where you are, and you want to get a massage. How and what advice could you give to someone who is seeking out a massage place and or maybe massage therapist? How do you know if they know what they're doing? How do you know if the place is a legitimately nice place? Like, what would you tell somebody who's in Connecticut who's like, hey, I want to get a massage. What should I go for? What advice would you give them?
Make sure the place is clean for one.
Yeah.
Needs to be clean. And to me, the therapist has to be a listener.
Yeah.
If your therapist is not a listener, it could be traumatic.
Yeah.
So I find that important also.
Okay.
And then depending what you're going for, if you're going for some relaxation or a problem, it needs to be fixed.
Yeah, I think cleanliness is a huge one. I quite a few years ago was in Fort Lauderdale, and I thought I'd treat myself to a massage, and when I rolled up to it, because I bought it on Groupon, I rolled up to the place, I was like, ooh, I don't know. And then I went in and I was like, oh, what's that? Oh, what's that? And so that was, I mean, the massage was great, but the place scared me. So just look for a clean facility, and, you know, when in doubt,
went through with it.
I did. I was like, it's a Groupon, I'm gonna do it. So I didn't die. I'm still alive. But that was traumatic, because I've always been a little bit of a snob. I've always worked in 4 or 5 diamond resort spas, so I've always had, you know, the best of the best. So so that was interesting.
I think one of the best things for the clients too to always keep in mind, and I try to remind my clients constantly, please give me feedback. If you like something, tell me, because I can do more of it. And if you don't like something for whatever reason, no judgment, I will definitely avoid doing that. Like some people don't like their ankles or feet or, you know, a different body part. Like, oh, when you go near me, you know, fine, it's okay. And like, but some people don't say anything, and you can feel them tensing, and it's like, oh, is this okay? And then they'll say no, and it's like, okay. So I really try to keep the communication open. So I think for clients, even when they go in, make sure your therapist understands what you're saying to them. You know, and a great way is to have them repeat it back, or, you know, their interpretation of what you're saying to them, because language is, you know, that is like, have you gone to go get a haircut and you tell your hairdresser you want this, and you end up like, what?
Does that just happen to you?
Yeah, it's happened several times. So communication's big.
It's huge, yes. Those of you who don't know out there, I decided to try to go blonde like a week before the Safer at Home thing. So I am about 17 different colors of all kinds of wonderfulness.
I can relate.
Yeah, see? So, but Shanti, I think that's a great point. And that goes back to our communication. A lot of people just don't know that they can tell you, and they need to. And from, you know, now that I'm in management and I'm not in the treatment room as much, you know, they'll come out to the desk and maybe vocalize not being happy with the service. But the first thing you ask is, did you talk to the service provider? And the answer is almost always no. So yeah, they have to tell you guys what they want, especially when it comes to pressure, and if it comes to a certain part of the body that they really want you to focus on, because you're not mind readers, and you don't have one set massage for everybody. Our protocols are for the products we use, and then you guys do the rest based on your experience and what your members and what your clients tell you. So yeah, that's a really great point. So our spa, I feel like, is pretty unique at the Wellness Center, where, you know, everything we're doing is really trying to enrich the experience of the member and the actual health of the body. Can you guys talk a little bit about Naturopathica, what you've loved about the product line, why it kind of differentiates us from the other massage establishments in town?
For me, I'm new, fairly new, 6 months, but I love the more natural product that you're using, that we are using. Our skin is the biggest barrier. Everything gets absorbed through that skin. So with Naturopathica, I'm happy using it on myself and using it on the clients. So to me, that's the biggest thing.
That's nice, because especially as massage therapists, you guys probably wash your hands like until they're like little chicken hands. So having nice products really makes a difference. What about,
I think the aromatherapy benefits of the naturopathica. I mean, I'm so in love with it. It's at the minute I have my clients smell it, you can just feel them go, oh. It is. It's amazing. It's amazing what, you know, the senses and this what you can get from smell. Total instant relaxation. So no wonder they don't talk to us.
They're like, talk to your service provider, but they're asleep in like 3 minutes. So. It's so funny.
But no, the smell of it, I mean, I love it, and I love their blends. I think that they really perfected. I'm really in love with aroma, with the naturopathica.
Good.
I think it's a beautiful product, and it's so lovely to use.
Good. Oh, I'm so glad to hear that. And are there any products that really help you guys do your job, like that, the arnica gel or the sweet birch? Have you found that there's something that really kind of helps prolong the effects of what you guys do in the treatment, and you know, stuff they can take from home and use at home? Do you like a line for that kind of stuff too?
I love the mixture of the Mighty Mint Rescue Cream and then the arnica on top of it.
Ooh.
Is phenomenal.
That sounds awesome. Yeah.
Try that.
Well, I know a couple times I've used the arnica gel on my neck, because being at a computer all day, I'm like looking all crazy with my neck. And that has helped me tremendously. I didn't even think about adding the Mighty Mint to it.
Yeah.
Something to do at home.
Yeah.
That's awesome.
The muscle rescue cream, that's one, I think for me is wonderful, because I got a neck sore or back sore. I put it on my back, can help me like 3 hours.
Wow.
4 hours. Yes.
Wow. That's great. And I love that we do, shameless plug, we do retail them. But I love the idea of going in, because, you know, if you're in pain, getting the treatment and feeling really good after, and then having something that you can then take home and continue to use and continue those benefits. That's probably one of the best things I found about naturopathica, because I've worked at a lot of different spas, and we've had some great massage oils and creams and gels, but it's not necessarily something that you would sell to the client. A lot of the times you just see biofreeze, and we all know that after a while, you know, we tend to build up a tolerance to that, and it doesn't really work as well as some of these more natural products that are specifically blended to ease pain and muscle tension. So that's really good to hear.
The Magnesium Flakes are my favorite, and I recommend them to a lot of clients that come in they're sore.
Oh my God.
Working out or whatever. It's like after your massage, like this evening, if you take this, you're going to feel amazing.
That's
great. And it really helps. You know, I often recommend they take a hot bath with that.
Yeah.
And it just adds on, like you said, it's like using one of the ointments. It just adds on to deeper relaxation.
Yeah. And we use those flakes in our pedicures too. And Angie gave me a pedicure, and she put the flakes in, and she did her thing, and it's the first pedicure I've ever fallen asleep in. Of course, Angie's like super quiet, but I was out. I was like, oh my gosh, my feet felt like little clouds of happiness. It was amazing. So that's another one. I totally forgot about that. They can take those home, and they could do the bath flakes at home, and it's a big jar. It lasts a long time. So cool. That's a great add-on. All right, so then let me see here. So the other thing is that with the safer at home, as we all are right now, a lot of people are probably sitting around more than they usually are, or laying around more than they usually do. So can you recommend any kind of self-treatment at home for aches and pains, and you know, like that kink in your neck after you watched all the episodes of The Office? Like, what can you be doing at home right now to help stretch? Oh, that's
Start
a good one.
stretching yourself.
Stretch. And if you can't figure out how, you know, what stretches to do, YouTube is my go-to for everything. And they have so many amazing little 20-minute, 15-minute clips that you can go and do some nice stretches. So take your magnesium bath and a stretch.
There you go.
You feel amazing.
There you go. Yeah, and shameless plug number 2, we are actually doing some YouTube videos with our instructors. And so they're doing stretches, and it's on our Wellness Center and Spa YouTube page. So go check that out. So what else can they do? I mean, I know, I don't know if this is something that we want to tell the members to do necessarily, but I bought one of those lacrosse balls from our shop, and I get up against the wall and I'm like a bear. I'm like, oh, it feels so nice. Is that something you
it's like
recommend?
Tennis balls, guys.
And rollers.
Okay.
2 tennis balls in a sock. It will go right at the base of your skull, along the side of your spine, all the way down to the SI joint. It's amazing.
Oh my gosh.
Nice.
Yes.
So,
but the Hypervolt as well.
Yeah.
That massage gun, you can get it on Amazon. You don't have to get the name brand. That for me has been a lifesaver.
Wait, right. This one?
Oh,
or
Pure Wave.
The Pure Wave. Oh yeah, like yours too. Yeah.
I have the Pure Wave and I use it.
I like Simple too.
You guys.
Yes.
Oh, those two.
Yes.
I use them all the time.
I like washa, and I think pretty easy for me during the night. I like during the night when I watch TV. I can use for my hand and also my feet. I have different one like this big one. We can like for arm.
And you just go. You go real light with that, right, Jing? You don't have to go strong.
Depend on your skin. If your skin pretty thin, you have to use light pressure. Also, I like use this one for my face. When I watch TV, I'm not just sit down there and watch TV. I just do a lot of like massage.
That's why you look like you're 25. We all know.
You can do this, massage your face. It's very good benefit.
And they can get those on Amazon, right? They make them out of jade.
We have some in our store.
Oh, that's right. That's right. I forgot. Yes. And if you can't get into the wellness center, they sell them on Amazon. They sell them there. I'll put it in the link in the bio of the video, what they're called, and maybe some links on how they can get a hold of them and that gun that you guys have, because that thing's awesome. And I love the tennis ball idea. Admittedly, the only tennis balls I have are the ones that are chewed on by my dog. So I like the sock idea too, because I mean, that would be something so great, because that's where all my tension is, especially if I'm, on a computer all day, or if I am watching TV. That tends to be where a lot of the pressure builds up. So that's great. Thanks, guys. The members will really appreciate that. Okay, let me see if there's anything else. I guess we can wrap up the conversation with, just in case if our members you don't know you or haven't come in, can we kind of take it around the room a little bit, and can you maybe tell them a little bit about your training and experience and what massage has meant to you through your career? Can I start with Sally?
Sure. Let's see. Okay, so I've been at the club since 2011. Prior to that, I was at a spa here locally, and then before that, I actually worked for a chiropractor, which was such a great foundation for me.
Oh, yeah.
And so, let's see. I forgot what am I supposed to be talking about?
You.
I get that far, my mind goes.
So how many years in total have you been a massage therapist?
So 13, about 13.
Yeah.
It is honestly, aside from, being a mom, which is my ultimate heart's call, it is what I was made to do. I like to walk through life in terms of what doors are open for me. And the doors for that were so wide open. And I thought I would go in and learn how to give a great massage and work at that chiropractor for the rest of my life. And then something happened and it opened up a whole new world. And honestly, this is my heart and it's where I love to be. There's always new stuff to learn. There's, it's the journey, it's not the destination. So my latest training that I've been doing is called the Emmet Technique.
Yes. Tell us a little bit about that.
Oh, I love it. Oh my gosh. So I've completed 5 of 6 modules. The 6th one will be this summer sometime, depending on when we're back up and running. That being said, I am allowed to use it now. So it's a light touch therapy. It's designed to reprogram or reset muscle memory very quickly. It's designed to relieve pain and discomfort really quickly. We're increasing range of motion in a matter of minutes.
It's incredible. I've been through it. It's awesome.
Yeah, it really is amazing. So I'm really excited about that. The sessions tend to be shorter. They tend to be result focused. So somebody comes in with a shoulder that won't do this, and we spend, 15 to 30 minutes working and holding different points. And in most cases, there is an increased range of motion by the end.
Yeah.
So I'm really excited to start using that and just, adding, again, another tool to this beautiful journey that I'm on.
Yes, it is. I have to say the spa industry in general is, it's always changing and growing. And if you have the will to continue learning, there's plenty to learn and plenty areas to grow in. And so I had, when Sally came in with the training, she demoed on me, and I think it took my neck from like, to like all the way down to my shoulder. It was incredible. It's different. It's just a different kind of treatment, but man, was it really, really beneficial and really great. So we're really excited for you to bring that to the club, and for you to go through all of that training was amazing, and still work full time and still be a full-time mom. And so awesome. And we're really, really happy and fortunate to have you. I feel lucky that I feel like I've had you by my side, since we started. And when I first came in and we were almost open, and you and Jing, because you were the first two there, have really been so helpful to me. I really appreciate that. So thank you. All right. Jing, do you want to go ahead next? Tell us a little bit about your experience and what massage means to you.
Okay, so after I moved to America, I decided to change my career. I back to school, got a massage license. So after that, I working for a chiropractor and a salon. And so after I back to school, I decided to learn facial. I found the job there. They looking for massage therapists from Vineyard Country Club. So I started working here. So I like here a lot. And when you massage for people and they feel good, make you feel good too. You like help people. And for my experience, when I do massage for my customer, when I massage their feet, I like to add on little by the reflexology for them. So after that, I can see the different result. And a few years ago, I went to Miami, learned the lymphatic drainage. I think that's very good treatment for the people. Especially we have some people like a swollen leg or very thin skin. I can use that for them, and it's very good. How to say? Feedback.
Yeah, for sure. And so, how many years have you been a massage therapist now?
7 years here and 2 years other place, salon and chiropractor.
Wow, that's a long time. And the fact that you've added facials too is wonderful. When I used to teach facials, I would get a lot of massage therapists that came in and looking for a second license, just to give your body a little break and to expand a little bit. And so being able to go from a massage to a facial, or a facial to a massage right in the same session is like, forget it. You don't even know what day of the week it is anymore. You walk out of there and you're just like, I'm done for the day. I'm going to go take a nap for a week. So wonderful. Well, I'm really lucky to have you, and thank you so much for joining us today. How about you, Tina? Tell us a little bit about your experience and what massage means to you.
I started in 2013, actually, as a nurse.
That's right. I forgot you were a nurse.
Yes. So I was practicing as a nurse, and to me, I just wasn't getting that satisfaction, believe it or not, of helping people.
Really?
I'm more of a natural girl. I like the natural approach to health.
Yeah.
So I decided to go through massage therapy school, and from there on, I can't even tell you what it's done to me. I have that satisfaction and that I love that helping people, to be able to help people. And the biggest thing is the one-on-one.
Yeah.
I didn't get that.
Right.
And if it's just an hour massage, at least I know it's a one-on-one situation where I can help my client fully for that 1 hour or that hour and a half. So for me, it's been huge. I'm new. I'm 6 months at the Vineyards, and let me tell you, I go home every day that I work saying, I love my job. I love everyone I work with. I love all the members. Like, everybody's family.
Yeah.
And that's a big thing. So every day I go home saying, I love my job.
Oh, yay. That's like goal, like hashtag goals. That's it right there. So it's wonderful. I feel like you came to us in like this crazy twist of fate, and it almost had to happen that way for us to have you on board. And so I absolutely love that. I love that you're here and you're around, and that you're, you know, working with us. And I know that you're at another place as well. You know, most people in the industry work, you know, or juggle a couple different places, but every time you come in, it's like a little ray of sunshine walks in, and we really appreciate having you. So thank you. And thanks for coming on the show today, the Zoom show.
Thank you.
And Shanti, saving not to make you last, you're just on my screen last. So tell us a little bit about yourself and what massage means to you.
Massage means everything to me. It's just everything. It's a total way of healing, getting yourself. Internet is unstable. It says my internet connection is unstable. Can you hear me?
Yeah.
Okay.
We gotcha.
Okay. So I got into massage very early through my yoga. My yoga teacher was my massage therapist, so that got me into teaching yoga and to loving massage. That was 30 years ago.
Wow.
And it's never stopped. So I every treatment I get, if it's something different, like I got a Thai massage from a friend, and totally got addicted and said, oh my God, I need to learn how to do this. So he invited me over to Thailand, and that's what I did. I went there and learned my Thai massage.
Wow.
Same thing with Hawaii, when I was in Hawaii with the Lomi Lomi. And so everywhere I've traveled, I've always gone and gotten treatments and picked up tips, and I just love it so much. There's so much you can do and through massage and through yoga. It's all movement, it's all breathing, it's all total relaxation, and putting yourself in a state of healing and loving and blessing. And that's where I'm at. So every time a client leaves my room and they're smiling, I'm like, yes.
Oh, yay.
So I love making people feel good.
Yeah.
And I'm in the right profession. I'll never stop. I plan on massaging till I leave this earth.
Well, it's a gift you have, that's for sure.
Yeah, it's my pleasure. I love it, and I love helping people, and this is my contribution to the earth. They say you're here for a reason. That's what I feel like, that I help people feel better in their bodies and in their mind.
Yeah.
So, it's so connected.
Yeah, and I never really thought about that before with the yoga. So for our members that don't know, Shanti teaches our chair yoga, and then quite a few other. You did intermediate for a while, you did beginner, and then she's added therapeutic, and then you've added Thai massage. Can you tell them a little bit about that?
Well, Thai massage it's like you're doing your yoga treatment. I'm doing your yoga practice for you. It's deep stretching, it's acupressure points. So it's a really interesting treatment, and people that get it, especially athletic people that are very tight, absolutely love it. You lie on a mat, you have your yoga clothes on, and I'm lifting your limbs and stretching you, and going into areas that you usually can't go into on the table with other ordinary massage, and really, really getting some deep stretches, deep release. but it's such an old tradition. It's thousands of years old, and it really works. I mean, you really feel amazing after you have that treatment.
Yeah, and I didn't realize that you were certified in Lomi Lomi too.
Yep.
Okay, we'll have to talk about that later. Ladies, I thank you so much for your time today, and I think we can go ahead and wrap up, and thank you to the members for joining us and watching this. If you haven't had a chance to get a massage at the Vineyards Wellness Center and Spa, definitely come in and see us. We'll book the massage for you. We have availability. The massage off season is open Monday through Friday. So I think, who knows when we're going to be reopening and going back to normal. But we'll probably be with some summer hours, but we'll be there at the desk to book your appointments. All of these lovely ladies, and we also have a couple other gentlemen massage therapists are there and available, and we have all kinds of times for you. So let us know if you'd like to book a massage. And in the meantime, until we can get to that point where we're taking services again, please stay safe and stay home. And if you need anything from us over at the Wellness Center, don't hesitate to call. All right. Thank you, ladies. Thank you so much.
Bye. Miss you.
Thanks. Bye.
Miss you all, and we'll talk to you soon, okay?
Yeah, let's do this again.
Yeah, for sure. All right. Okay. Bye.